Well, good morning. We have a couple of announcements today and some guests, and I'd like to invite Denise Barnes from Activate Allen County and Lori Nestor from the WIC program to come up, and others as well with you for an announcement, and I have a proclamation as well that's related to this. So,
someone to hide behind the banner.
Would you like? Who'd like to take the lead?
I will.
Lori? Okay.
Okay, there we go.
Every year the WIC program acknowledges and recognizes World Breastfeeding Week, which is August 1 through 7. We also recognize Breastfeeding Awareness Month as the whole month of August in the United States, and so we try to do some festive things during that month. This year we are partnering with Activate Allen County and some grants at the Health Department to do some of our focus work. The theme this year for World Breastfeeding Week and Breastfeeding Awareness Month is focused on supporting breastfeeding moms, and that can be in any situation, whether you are an employer, whether it's through government policy, whether it's family support, health care, in times of emergency and crisis. There are ways of supporting a breastfeeding mom to fulfill her breastfeeding goals. And one of the things that we are focusing on this year is on employers in the area. Our banner here has the International Breastfeeding symbol on it. We have window clings with that symbol on it that we will be making available to employers and businesses who have decided that their place of business is a welcoming place for a breastfeeding mom. That means they can come in and breastfeed their baby anywhere in that business, and they won't be harassed by staff or by other patrons, and they'll be supported. We are also encouraging businesses to have lactation policies and pumping policies that support the federal pumping law, so that a breastfeeding mom has break time to pump for her baby, or in some cases moms can go and actually breastfeed their baby depending on where their baby is during the day. These are not additional unpaid or additional paid time. It's part of their normal breaks or additional unpaid time, however that works to fit in with their schedule. It doesn't have to be a designated pumping room that's always the pumping room. It can be an office. It can be, in some cases, it's a closet or a conference room, but just some way of making that a private space for pumping, and it's not a bathroom. So that's one of the projects that we will be working on today. Denise, do you want to talk about LACCA? Or do you want me to?
Oh, yeah. Do you want to get up here, Phyllis? Activate Allen County, we wanted to recognize LACCA for being the first business here to take the stand. And, I mean, they've always been very supportive of their moms, but they took it one step further. And do you want to tell them about how easy it was to do this?
It was really easy. We wanted to promote breastfeeding, and we know how important that breast milk is for the baby, for their development and the gains that they need to make in those first years of life. So we were able to convert one of our rooms in the basement as a breastfeeding room. It was a bathroom, but we eliminated 2 of the stalls that were in there, and we continued to leave 1 stall, so there's still some privacy. We added a couch, there's a sink, everything that a breastfeeding mom would need to have a successful experience that first year of life for their child, to get the nutritious food that they need.
Right. And if you want to go on Activate Allen County, we have their picture of their room, and so other businesses in the community can go and see how they did it and model their areas after them. And we also would like to recognize the City of Lima for implementing the first actually breastfeeding policy. So I don't know if you want to talk about that.
Sure, I can.
That's in there.
Well, the city has been one of the sponsors and participants in Activate Allen County. So as these various programs have been rolling out, we felt it was important for us to assess what we could do and make changes that we can accomplish. And what we've decided and have now put in place is that as we're publishing this to our employees so they know it. Currently, we don't have any breastfeeding moms in the ranks of the city, but for the future, we want them to know that we will make accommodations in location. And you have to understand that the city's facilities are actually in numerous places. It's not just the municipal center. We have our treatment facilities, we've got our garage facilities, all those kinds of things where men and women are employed. And over time, we would expect that young women, childbearing ages, will in fact be employed in various locales. So we will then follow as that happens, and there is a request for the accommodation. We will make the accommodation, and it will be, we will create a private space. It will not be a restroom that will provide to the breastfeeding mom the opportunity to pump or breastfeed in private, as it was described on their own time. So we think that's a reasonable thing to do, and particularly given the benefits that it has for the child and the mother, we think it's the right thing to do. And it's really in that context that I'd like to offer the following proclamation. Whereas the residents of Ohio are deserving of good health throughout their lives and exclusive breastfeeding for the first 6 months of newborn life, as recommended by the American Academy of Pediatrics, provides the best possible start to life in all areas of development. And whereas the health benefits of breastfeeding for the infant include a reduced risk of obesity later in life, reduced risk of sudden infant death syndrome, fewer ear and respiratory infections, a reduced risk of developing both juvenile and type 2 diabetes, and an average increase of 6 points in IQ by the age of 6. And whereas mothers also receive benefits from exclusive breastfeeding that last a lifetime. Specifically, the longer that mothers breastfeed, the lower their BMI, blood pressure, triglycerides, waist circumference, and LDL cholesterol. Longer duration of breastfeeding also lowers mothers' risk of type 2 diabetes and metabolic syndrome. And finally, new evidence shows that mothers who exclusively breastfeed have a lower risk of depression. And whereas a 2010 study published in Pediatrics found that if 90% of new mothers breastfed, the United States would save $13 billion per year in health care costs and prevent more than 900 deaths each year. Breastfeeding also protects the environment by decreasing energy use used to process formula and dispose of container waste. And whereas these benefits, the CDC 2012, despite these benefits, the CDC 2012 breastfeeding report card found that only 62% of Ohio babies are fed any breast milk, and only 11% of these babies are breastfed exclusively for 6 months as recommended. And whereas the Surgeon General has issued a call to support breastfeeding, which in part focuses on the need for communities to increase societal support for breastfeeding. Now, therefore, I, David J. Berger, Mayor of the City of Lima, do hereby proclaim August 2013 as Breastfeeding Awareness Month in our community and urge all residents to join me in encouraging and supporting breastfeeding. In witness whereof, I have hereunto set my hand and caused to be affixed the seal of the City of Lima this day of August 2013. Ladies, good luck in your work, and it's important for the children, the moms, and all the rest of us.
Thank you.
You're welcome. Thanks for being here.
Thank you.
Congratulations, Phyllis. You did well. Phyllis didn't want to talk this morning.
But we got her too.
Mike Caprella's here, and he's prepared an hour-long dissertation on the intercept sewer being rebuilt on, oh, that was Gary that had prepared the hour-long. He's got 3 minutes.
Right. I didn't want to be here either and talk, but just so you know that. So, actually, I have a bit of good news for the motoring public of Allen County. Ever since early July, right after the 4th of July celebration, due to some work the Utilities Department was doing, we had to shut down North Shore Drive adjacent to Froke Park. And in conjunction with that project, we also had to shut down Collett Street at the South Collett at the Ottawa River, right by the Red Cross building. Well, fortunately, yesterday the contractor was able to open Collett Street, and today they are going to open North Shore Drive. So I'm sure that's going to make a lot of people happy. It's usually an inconvenience, but it had to be done for the project. We're in the process, and they're not finished yet, but at least they're going to be out of the roadway area, of installing about 4,000 feet of sewer lining in a 54-inch diameter sewer main that goes to our wastewater plant. This is a $2.7 million project and should be finished by the middle of next month. But the good news today is Collett was open yesterday, North Shore will be open today, and there's still a little bit of work to do in the roadway with some striping on North Shore, but that'll be finished, and you can still, traverse through that area. So that's all I have to say.
Okay, very good. Thank you, Mike. I want to then just comment. I was recently, the latter part of last week, attended the leadership meeting of the U.S. Conference of Mayors, and was successful in arguing that the legislative proposal that the Lima team has put together for changes to the Clean Water Act has now been prioritized by the conference as a legislative focus going forward. The new president of the conference, the mayor of Mesa, Arizona, has had announced at the time that he was elected that he was going to make the unfunded mandates issue a top priority. And this happened back in 1995 as well. And there was a piece of federal legislation that was passed that required Congress to take some various steps should they pass future unfunded mandates. The problem with that was that they exempted anything that they had passed previously. So all of the clean water related mandates, in fact, did not require any of the other steps that the Congress was imposing. It simply had not been grandfathered. The conference is going to go essentially in two directions. The first is they're going to be conducting in coming months a general survey of cities regarding all unfunded mandates coming from the federal government. And secondly, because our legislation is very specific to the Clean Water Act, they will begin focusing a lot of energy on the Hill to pursue all elements of that. So I was pleased at the support that's there. Last week as well, there was a presentation in California to 80 California cities, and in general, very strong support for the proposal. So we're going to continue now to build on a state-by-state basis coalitions of cities that will be working with their federal legislators to try to pursue changes to the Clean Water Act. That's all that we have for today, so we'll break down for interviews. Thank you.